Good afternoon and welcome to today's presentation as part of the 2020 conference for the Association of Recovery Schools, Association of Recovery and Higher Education, and Association of Alternative Peer Groups. My name is Olivia Pinelli and I'll be your host today. We're joined by Dr. Allison Smith of Louisiana Board of Regents, who is presenting references available upon request, learning how to propel prevention forward through service. Just a few reminders and logistics before we turn things over to Allison. Today's presentation will be recorded and uploaded to YouTube under a password protection for all conference attendees and presenters. You'll be able to go back and access all the information if you have registered for the conference. Please don't share this information with people who are not registered without ARHE consent. Conference sessions are approved by a number of continuing education providers. Please check our website of the various conference emails or send out additional information. If you have any questions, please email conference@collegiaterecovery.org. Before I turn things over to Allison, I want to provide you with a brief bio. Dr. Smith facilitates the Louisiana Higher Education Coalition, statewide core survey administration, provides professional development training, facilitates campus community partnerships, and renders technical assistance around the issue of substance use prevention in Louisiana colleges. Allison's experience includes internships with both Nurse Family Partnership and the Substance Abuse and Mental Health Services Administration, SAMHSA. In the Center for Substance Abuse Prevention, Dr. Smith, a native of Baton Rouge, received a Bachelor's of Science degree in psychology from Southern University in 2009, a Master's of Public Administration from Louisiana State University in May 2011, followed by a doctoral degree in educational leadership, research and counseling with a specialization in higher education administration in 2016. After spending 8 years with Kazu on the Louisiana State University campus, Dr. Smith is currently the program administrator for its new home, the Louisiana Board of Regents, as of July 2018. In her current role, Allison continues the aforementioned activities while advocating for the collegiate recovery programs and supporting the broader campus safety policy work and initiatives of Louisiana Board of Regents. Wow, what an impressive bio. Thank you for being here. So I'm just going to turn things over to you and your presentation.
Thank you all for having me. So I will jump right into everything. All right, so as Olivia mentioned, I'll be talking about references available upon request, learning how to propel prevention forward through service. So a little bit about today's presentation. We'll go over some background information about myself, our office, some of the learning objectives, some of the research behind the why, what we do, learning how to identify key stakeholders, what is social capital, and how that can help you to build campus community collaborations. I want to start off with a quote from Rich Lucy from one of HEC AOD's recent webinars. One of the things he said was about building capacity is that you need to be prepared to answer the question, what's in it for them? And so I want you to kind of keep that question in mind, in the back of your mind as we go through today's presentation. What's in it for them as we're talking about building your capacity through service? Okay, so a little bit of background. I know it's kind of weird, we're virtual, completely virtual this year, so I'll tell you some things about myself. I'm a native of Baton Rouge, Louisiana. I have been here all 34 of my years. I am the youngest of 7 children. I could live off a diet of hot wings and crawfish if it wouldn't kill me in the long run. I am a graduate of Southern University and LSU ×2, and I never have to go back to school again, and that I'm excited about. So some background on our office is that our office got started in 1998 after the 1997 binge drinking and hazing related death of Benjamin Wynn right outside the gates of LSU's campus. At that time, LSU participated in the Robert Wood Johnson's A Matter of Degree program. And what that program did was selected 10 campuses that had high binge drinking rates and looked at them to work on environmental strategies to reduce binge drinking rates. Throughout both funding cycles, our office was created and sustained. It initially began as the Campus Community Coalition for Change, the CCCC. You don't have to remember that. But then after the funding was exhausted for the Robert Wood Johnson grant, the Louisiana Department of Health Office of Behavioral Health began to fund our office. And one of their things was, if we fund you, we want you to take the work that you're doing at LSU and to do it statewide, to provide this type of services to all of the campuses across Louisiana, which is what we have been doing since 2006, since we've been funded by the Louisiana Department of Health. In 2002, one of the renewal deliverables for the Robert Wood Johnson grant was that you create a statewide coalition that focus on substance use prevention with your campuses. And so where we got that was the Louisiana Higher Education Coalition. And I'll talk about that shortly, but that began in 2002. July 1st, 2018, our office moved to the Louisiana Board of Regents. Fall 2017, LSU was back in the news for a hazing-related, binge drinking-related death with the death of Maxwell Gruber on LSU's campus in fall 2017. And at that time, our governor decided to ask every institution of higher education what were their policies and programming offering around the issue of substance use, education, the prevention things that we offered on our campuses. Some campuses were able to say, hey, we actually have a biennial review. Our drug and alcohol prevention program, you can take this and look at it. And some campuses did not. Those campuses that had their biennial reviews or their DAPs, we have been working with those campuses, providing free technical assistance and resources, bringing in people like Beth DeRico and Eric Davison from IHEC to look at helping them to get templates to keep their information up to date, providing free technical assistance to their campuses. And then our state's leadership began to ask, well, what is this LAHEC thing that some of the schools know about that they're working with that not all of them do? And then our state realized that at our statewide level, at our agency that governs higher education, that we had nothing that focused on prevention and substance use on our campuses. So the decision was made to move our office from LSU to our Louisiana Board of Regents so that we can have a broader impact on the work that we're doing with our campuses. And so I like to think of our focuses in two, the way we influence our state's population in two ways. We have a statewide focus through our office. Our office's name is the Louisiana Center Addressing Substance Use in Collegiate Communities, LCASU. And then we sit on statewide policy task force groups out of the governor's office. So all three of these committees, the State Epidemiology Work Group, the Prevention Systems Committee, and the Heroin and Opioid Prevention Education, or the HOPE Council, they all report to the Drug Policy Board, which reports to the governor and helps to influence policy and decision-making that goes into play across our state. And then we have our campus focus, where we have our Louisiana Higher Education Coalition to reduce alcohol, tobacco, and other drugs, another very long name for LAHEC. And so through that, we provide research and evaluation, technical assistance, and professional development. Mainly our biggest goal for tech research and evaluation is our core alcohol and drug survey that we offer free. All of our services are free to all of our campuses through our grant funding through the Louisiana Department of Health. We also do technical assistance, whether that's individual institution training, going and helping them prepare their biennial review or their DAP reviews. If they have a particular issue, whether it's tobacco, whether it's cocaine, we can bring in speakers for one campus for that particular issue. And then we do our core survey in the spring of odd years, and in the spring of even years, we do regional trainings, which I'll talk about towards the end of the presentation, where we bring together campus community partners and campuses in certain regions to focus on their specific issues at hand. And then for professional development, we provide an annual summit every year that is free, zero registration costs. We offer food and CEUs for all of our campuses to attend because we know that that's an area where they tend to lack professional development and opportunities. So we want to make sure that we keep that free for all of our campuses and all of our campus community partners statewide. Right, so some of the things I want you guys to walk away with today, 3 big takeaways. 1, the ability to identify key partnerships, the ability to prioritize task force, committee, and council participation because you only have so much time. And then understanding the importance of social capital and how that can help aid you in the first 2. All right, so let's go through the background stuff, the supporting evidence of why we do what we do. or as I like to call it sometimes, the less fun stuff. But it's like, so one of the big things we focus on throughout our state and most coalitions focus on is harm reduction. And what that means is that simply we look at that multiple scholars suggest the best way to address substance use in college is to employ environmental strategies that promote harm reduction. So one of the things that's different that makes higher education different from K-12 is that throughout K-12, students are typically taught zero tolerance. We understand that the substances are illegal, we get it. But what we found in college, when you get, particularly with alcohol, when you get to college, there's a segment of your population that alcohol is legal for. And even for the ones who underage drink or misuse or abuse alcohol, the goal is still harm reduction. The message changes from zero tolerance to harm reduction. How can we teach students to be as safe as possible, recognize harm, and being able to keep themselves and others safe? And so the belief is that the way to achieve this goal is to have a collaborative approach between local institutions of higher education and state, local, community entities who possess varying strengths to target environmental barriers in a systemic way. And what that means is that our students don't just stay on our campuses. Is that typically when students go out, they go out to bars or parties, they're not on our campus. They're in community spaces. So we need to have strong local community and state ties, ordinances in places, not only to protect our students, but to protect businesses. I don't think businesses enjoy having to file insurance claims from property damage due to fighting or something that has happened, one of the brawls we've seen recorded on something. I don't think businesses enjoy that. So we try to make sure that the least amount of people are harmed, teaching people the safest way, because individually, we all wear our seatbelts for the most part. Not saying that there's no people that don't wear seatbelts, but because there's a law, there's a policy in place that requires you to, you're more likely to change your behavior. Versus it's a lot easier to put a policy, a law, or a statute in place to help move people's behavior faster than it is to individually try to change each person's behavior. And the next piece, social norms theory, which was first coined by Berkowitz and Perkins in '86, which focuses on correcting the misperceptions, and the first social norms intervention was in 1989 by Michael Haynes at Northern Illinois University. Social norm theory predicts that interventions to correct misperceptions by revealing the actual healthy norm will have a beneficial effect on most individuals. So that's if we take a very grossly overstated point that all students drink all the time to the point where they're always flaking out. We know that some students tend to believe that, but by far and large, that is not the case when we look at the data. So it's taking the misconception and utilizing data to help correct the perception of the norm. That it's not normal that everybody drinks continuously or at a heavy amount or engages in substance use. And that one, providing information about healthy drinking norms and attitudes encourages most individuals to drink less or not at all, which is more consistent with their underlying values and intentions, is that they don't have the societal pressure to keep up with a norm that's not real by giving them the actual data. And so part of our campuses, we utilize their core survey data, or if they have NACHA data, the National College Health Association data, if they participate in that, or any other campus survey or data that they may have available for their campuses. And this is the 2009 Logic Model of Social Norms by Keller and Bauer. And this is a visual representation of what I just said. That one, you look at our data, we ask our campuses to look at their data, see what their underlying problem actually is. We may have a campus where there's someone on a task force, because we know this all happens when we get on a task force sometimes, that everybody brings their own individual agenda to a task force or committee or group participation project. And so let's say somebody really wants to focus on tobacco, but that's not actually your problem when you look at your data. Let's say your problem is marijuana. So it's looking at the data, one, to find out what your actual problem is, looking at the misperception, and the core asks a question about students, what do they think of other students' perception of use? So how much do they perceive that other students use a certain drug and their own consumption? And there's always a very wide gap for our results that students believe that their usage is very low, but the uses of the rest of the campus or certain groups is extremely high. And so the campus will participate in some type of social norms marketing campaign as an intervention. And the goal of that campaign is to correct the misperception and the injunctive norms. But one of the things we always stress is that social norms campaign, they're necessary when you look at the types of interventions you could participate in. This is one of the easier ones, but it is not an end all be all, and they work best when they are not standalone. That they are a part of an overall prevention strategy on a campus. That they're not. It's a one and done thing. They're not the end all be all silver bullet to solve every issue on your campus. Then you look at the anticipated outcomes of the intervention. And what you want to do is increase the use of protective behaviors and decrease hazardous usage patterns, which results in harm reduction. So we have more students that are using protective behaviors and less students participate in hazardous usage. The goal will ultimately, the desired impact will ultimately result in harm reduction, that you'll have a decrease in substance use related adverse consequences. So identifying key stakeholders. So some of the questions that need answers. Hashtag QTNA. 1, whose mission do you help further? Think about the task force, the agencies, the departments, the councils, everyone that you work with, that you come into contact with, whether through your focus of your work, one part of your mission, the overall scope of your mission, or your agency or your campus. Whose mission do you help further? Are there people that you partner with that are external, that they know that they can call on you because you can help them out with their particular mission? The next question is, who helps to further your mission? Who do you call on to help meet your goals? Who are the people that you know that you can call on if you're having an event, a community event, that you know that their mission aligns with yours in a way that you can call on them when you need assistance? Next, who do you work with out of tradition or habit? Who are the people, groups, organizations, departments, agencies that you're working with still, that you only because you work with them for the last 10 years? For the last 10 springs, you've always done this particular program the second Tuesday of April for the last 10 years. Who are those people? And have you evaluated the effectiveness of that programming or that relationship? And if you did, when was the last time you evaluated that? And lastly, whose partnership is mandatory? Because we know that we all get to pick everything that we want to do on our own, right? So who is it mandatory that you work with? As a grant funded organization, office such as myself, there are certain people that I am mandated to work with. Not saying that those relationships are contentious or anything, but by statute, I have to work with certain people. So whose partnership is mandatory? Who do you have to work with, and how can you reassess and realign that relationship so that it's beneficial to both of you? Right, and so get into social capital, and that is the messy, no guarantee of success in a relationships of trust, commitment, social relations, influence, and communication. And it is the resources accessible to individuals by involvement in social networks or other social structures. So this is how strong are your relationships that you've built and that you have. And additionally, it describes its focus on the cultivation of relationship, which allows for the promotion of collaboration, with support being a cornerstone of the concept. Who can you call on when you're in a bind? If you need to get 5 additional people to partner to host an event with you or to write a small grant pretty quickly, who can you call on? How much have you invested in people that you can pull upon those relationships when you need them, when the time comes? And also is how and when people associate with each other. There are certain people that can call me right now that can probably get anything from me because we've built a relationship of trust over the years, working with each other, mutually supporting each other. And then there are some people I'm like, let me see if I have time. Let me see if this aligns with my goal, helps to further the mission for both of us. How do we fit? There are some people that they may have to get a call back or a follow-up email. But the people who have a lot of social capital with me, they can call and get that right now. And I also have people who that's possible for as well. And so structural social capital, it measures the structural components such as network size and density. So let's say you know one person at an organization, but I know 10 people at that organization. My network size in that organization or group is going to be a lot stronger than yours, that it's more dense. And then depending on the length and the severity and the depth of those relationships, but if you know the one person, if we find out that I know all these people and you only know one, you might say it may even appear that I have a stronger structural social capital with that particular company or agency. But let's say that it's all people who work 9 to 5, day in, day out, but you know the president of the company. That's the one person that you know and that you've been best friends since third grade. That changes the dynamics of what that looks like. And that brings us to there's three types of structural capital, social capital. The first type is linking. And when you think about linking social capital, I want you to think vertical. So that's knowing that is strictly knowing that your access is driven by mainly by position and power. That because of the position you hold, positional power, there are certain powers that come with your particular position. If you're the president, the CEO, the vice president of student affairs, there are certain powers conferred based upon title. And that allows you to reach out. If you're the vice president of student affairs, that gives you pretty much easy access to call another vice president of student affairs. It's seen as a very, or you can call the president, it's reaching up, the ability to be able to reach up. And then we get to bridging, thinking horizontally, and that's increased that access and increased access based on personal experience and very referral heavy. And so those are kinds of things where, one, you look at that advisory councils and boards where people can recommend you to serve on advisory councils or boards. And that's where you come together with people with like-minded goals. If you're all serving on a particular board, there's an interest that you all share in furthering the one mission of that particular board. So being able to, because you have certain experiences that you refer to these types of things, that's the kind of social capital that will help put you in those kinds of places and build those relationships. And then lastly, we have bonding. I want you to think trench. Those are the people day in and day out that do the heavy work on in any particular issue. And I want you to think social support and assistance based on employment similarities. So if I talk about health promotion or substance use prevention on any of the campuses or collegiate recovery, there's a certain experience, shared experiences that most people in the counseling, health, and wellness centers will share. That because they all do this work day in and day out, that there's a certain shared experience that they have that people who even oversee these departments but don't do this work daily, they don't get to experience. And so some of those things are coalitions and task force. So there's one of the things that was pretty popular a few years ago was sexual assault task force, sexual climate surveys, those types of things. Those people who were on those particular task force all had a very storied background with day in, day out. Those were the type of people that you were likely to run into if you were experiencing that issue on your campus. There's a shared experience in knowing how to deal with that particular issue. Right, and so we'll get into some of the more fun stuff now, looking at campus community collaborations. And so one of the things we've been able to do a few of them with our campuses and then help other campuses participate with their regional behavioral health offices and things of that sort. And so one of the things about remind them is to use legitimate data using their core survey and other data that they have available on their campuses, being creative, avoiding the health terrorism messages like the just say no, those kinds of things. And then using marketing strategies such as humor and attractiveness, things that you see on TV that you never get bullied into buying a product on TV. You never get bullied in ads. So one, being able to make sure that it's something that students are interested in. So our first social norms campaign was back in 2014. We were still at LSU. We partnered with a group, a PR class, a capstone class of graduating seniors. They were graduating PR students, and what they decided to do is we met with them for an hour, then again for an hour and a half, and I went to an hour and a half presentation at the end. So about 4 to 5 hours working with these students. When they came to me, we did a preliminary meeting. We did background on our office. We looked at, they did a SWOT analysis. They did survey research. What we found was that one, we had very low visibility on our campus at the time. One, because our office was kind of ducked off somewhere. But one of the things these students were able to do, they asked me what was our budget for looking at our drive, our campaign. And I said $0 because I had zero money. And so what they were able to do is they did they came with the campaign, Who Will, I Will. One of the things in their research that they found was that people 18 to 25 years old were one of the biggest recipients of blood donations from people particularly involved in car crashes and things of that sort, knowing that their age group was one of the high risk particularly for our region, drinking and driving was a bad issue at the time for our particular region. And so they wanted to help replenish the blood supply that they were causing to be drained in their after doing their research. And at the bottom of the flyer, you'll notice it says 2 tickets to Bayou Country Superfest. This was the first year that Bayou Country Superfest was held, and it was at LSU. They got someone, I still do not know to this day, to donate 2 like VIP tickets to Bayou Country Superfest. We had zero budget. They put on an entire blood drive in the LSU Student Union. They got giveaways from local vendors, gift cards, T-shirts, all of these things. And what we found out through the course of that program was that if you give students something important and meaningful to work on, that they will produce amazing results. And we also, the professor we partnered with in the LSU Manship School, Dr. Wang Park, she was interested in the topic of prevention and how do we help correct some of the norms that we begin to see on our campus, some of the misperceptions. And so we found a great way to do some curriculum infusion, some collaboration with one of our on-campus partners, and it was an amazing turnout. It was so amazing that in 2015, we decided to do it again. So this was another group of graduating seniors again. This is my girl power group, I like to call them, that they nicknamed themselves. And so these students produced a 150-page campaign book that was absolutely phenomenal that I still have to this day. And so they did the same thing, came in, did a meeting, did a SWOT analysis, they did survey research, focus groups to find their messaging. And there was their Know Your Limit was their campaign they came up. So if you're unfamiliar with South Louisiana, EAUX, for no, anything that can be an O is commonly swapped out with an EAUX. So like Go Tigers, GEAUX. And so they decided to switch that out. And that was the messaging that resonated most when they did their focus groups. And so they did targeted events. So they did one, know how to survive spring break, know how to help, where they taught bystander intervention techniques. They taught students, Greek students, what are the signs of an overdose? I mean, alcohol poisoning, things of that sort. When should you call for help? And so they had these are some of the things they gave out. And I'm also getting to the point where I realize I'm going to probably have to bring back the red solo cups, as we're finding that we're having, just talking to some of our campus professionals, we're having an entire new generation of students that we feel like we have to go back to the very basics on. So again, they're coming from a K-12 world where they're being taught zero tolerance. But so that means when they step foot on our campuses, they have zero information on harm reduction. We're not telling them how to safely use anything. We're telling them how to reduce harm so that no one dies or is seriously injured. And so they did an event in our Free Speech Alley at LSU where they talked about the beer, wine, the liquor. What do the lines on the solo cup mean? They did another event. So the one over there with the cups, they made non-alcoholic Jello shots. They had 6 steps to surviving spring break. Stick with the squad, know your limit, don't be thirsty, hydrate, that way to convey those safety messages. And then what's in the middle is a banner from a tabling at their last event that they did. You notice in the bottom, it says it says studentcity.com and red down at the bottom. And on the top over there, under their bag on the left, that is from Insomnia Cookies. They got Insomnia, all types of people to provide them with all kinds of giveaways, goodies. And that's a Raising Cane's basket on the table as well. Again, our budget was 0, and these girls produced amazing results. And so their last event, I was very skeptical about. It was called Know Your Limit. They took over Bogey's, which is a local bar not too far from LSU's campus. But what they did is they got the owner to let them take over trivia night, and they did alcohol prevention trivia. Substance abuse prevention, alcohol awareness trivia. They had been tabling for 2 weeks on campus, and then they took over Bogus at night leading up to spring break. And then this was the turnout for the event. We were very shocked, very surprised. They did an amazing job. And I mentioned Student City on the previous slide. Their grand prize for the alcohol awareness trivia was a spring break trip for 4 to Cancun from studentcity.com that they got donated to them. And so again, we were absolutely shocked that they were able to get a trip donated to them, but they did an amazing job. And again, this is something that they got to take with them when they graduate and say, here's a 150-page plus campaign booklet that I've done already for a state office at LSU. And so it was an amazing experience for them, and it was an amazing experience for us. And so after the success of that particular program, we had one of our other regions. So our state is broken up into 10 regions, basically our major metropolitan areas of Louisiana. So our region 1 is New Orleans, region 2 is Baton Rouge, region 3 is our Houma Thibodeau area, region 4 is our Lafayette area, region 5 is our Lake Charles area, region 6 is our Alexandria area, region 7 is our Shreveport area, region 8 is our Monroe area, region 9 is our Hammond area, and region 10, that is our Jefferson area, but we typically combine regions 1 and 10 into a greater New Orleans area because we don't physically have any schools located in Jefferson. And so when it came down to 2018, after that time, one of our regions, region 9 in Hammond, they were very, very impressed by the I know who will, I will, and know your limit campaigns. And the regional office in that area is Florida Parish's Human Services Authority. And they worked with our local campuses. They decided to take some of the money, that funding that they had for their office, to provide social norm campaigns, not just to put on one of the campuses, but to run it throughout their entire city, their entire parish of Tangipahoa. And so they did focus groups with their students from the campuses in that particular region. They worked with our liaisons, they got students, they did focus groups, and they completely funded this entire campaign. What was very interesting is that Florida Parish's Human Services Authority, they hired Five Stones Media to create the campaign. And Florida Parishes and Five Stones Media, they came up with what they thought was a very great idea. And they presented it to the student groups, and they absolutely hated it. The student groups hated the idea. And so after working with them, this is what they came up with. Something that was very impactful for their community and that they're still using and running to this particular day. And so I'll talk about, that was back in 2018. And one of the things that, and I've gone, and so with this, I'll back up a second. So with this, I had gone on request by Florida Parish's Human Services and Southeastern Louisiana University in this region to go and do a presentation to their leadership to talk about why it was important and how would this look during a social norms campaign, that the campuses and that the local regional health office could partner together. And so again, being able to be of service in that particular region. Our logo or anything is not on here, but one of our goals is to help push prevention forward. That if you don't worry about who gets the credit, the results will come. So being able to help them in this particular way, just lending expertise, serving with our particular campuses. And so back in 2018, there was a meeting I was invited to. I know that we all have a ton of collaborations and task force and committee meetings, but our local regional health office in Baton Rouge, Capital Area Human Services, was having an event where they were rolling out their campaign. One of the campaigns they had focused on opioid misuse, substance use with teen girls. And I went to the program and I asked a question. I was very engaging, talking to our representatives there, to other people that are asking questions, talking to some of the young ladies that participated in the program. Went great, didn't have a second thought about the program. About 2 weeks later, I get an email from one of the community partners there, the director of prevention there. And she asks, well, we're having a red carpet affair. We want to celebrate the girls for their participation in the event. Would you like to come? So went to the event, had a great time. They did an amazing event, and they showed all the short videos that the young ladies had produced and written and shot. And some of the other, and we got to talk to some of them. They did videos for drunk driving around prom season and things of that sort. So it went great, but I really want to point out this first. And I was there as well. I went there. It was a very nice event. But what I want to point out about this is this person. This is Vivian Getty. She is the director of prevention for Capital Area Human Services. Because I went to the event that Vivian invited me to, so let me back up a second. Throughout my time in my particular office, and the people who had come before me, they had talked about how hard it was to forge a partnership with Capital Area Human Services, that we just couldn't, our office and their office could never seem to get on the same page about what we could do to work together and make that come to fruition, that there would always be talk, but nothing ever came about. And so I went to Vivian's, their debut earlier a couple weeks ago before this particular event, and watched the unveiling of the program. And what happened was Vivian called me about 2.5, 3 weeks later and said, we really want someone who's pretty young to kind of facilitate a panel discussion at the event with the girls about their participation. And I would love it if you would be able to do that. And I did. And so one of those things was, one, taking time out of my day, being of service, going to support someone else's program, then open a door for the beginning of the partnership with our particular offices. And so that partnership is still ongoing and still given to this day, because in 2019, spring 2019, we had our minor misconceptions campaign. I got a call again from Vivian Geddes of Capital Area. She said, Allison, we have some additional funding that we want to spend, but we want to look at underage drinking and we want to do something with our collegiate communities here in Baton Rouge. And so she said, we know that you did the I know who will, I will, the know your limit, and that we know that you helped them over in Florida parishes to work with their campuses to do something. Could you help us to do something here in Baton Rouge? And I said, well, I'm actually not on the campus anymore, so it's a little bit more difficult. I said, but because I have built such great relationships, I was able to call Dr. Parker again over in the Manship School and say, hey, I have another opportunity to do a third social notice campaign. Would you like to participate? She was out of town. She was on sabbatical doing some things, but she said, no, but because I trust our relationship, let me recommend you over to another one of our professors in the Manship School who had just won the Bateman Award, which is the top PR award for student competitions in the state, in the country. And so we worked with them. Sadie Wilkes was an awesome presenter. And so that's where we got the Capital City Communicators. 4 students who we worked with this particular time, they've all graduated. And so working with them, we were able to come up with, they produced a minor misconceptions campaign. Again, on the 2 things I'll show you next, you will see our logo nowhere. Served as unofficial advisor to their campaign. It was an amazing experience for the students. And so one of the things, these are some of the billboards that they had. They did focus group, they did survey research with students from LSU, from Southern University, from Baton Rouge Community College. And so one of them says 4 or less, 83% of local college students reported not binge drinking the last time they partied. And then hashtag ride responsibly, 93.7% of local college students reported using a transportation service the last time they partied. These were billboards that ran along Interstate I-10, our major highway that runs between our campuses. And so the students got amazing real world experience. And this is them showing pictures from their Unity event for all of our campuses that focus on underage drinking at Red Stick Social, which was a very new and very poppin' place that had just opened maybe 3 weeks before that. And they were able to get in, host an event, and get amazing rates. Again, most times people don't tell students no. So that was amazing for them. And then one of the things mentioned that they got some real world experience. All 4 of them told me that they never want to work for public agencies ever. So one of the things that I mentioned real world experience, they found out how much paperwork it costs, how much paperwork is involved to buy anything. Napkin, they wanted to change the design on the napkin. And once they found out they had to fill out like 4 forms, they just like, we'll just keep the original napkins, don't even worry about it. And then they found out why they couldn't have bourbon glazed chicken at an underage drinking event, just different things that they found out about. And so, and I mentioned initially that our first 2 groups did not have a budget when they were working directly with our office. But this particular group, that after the Capital Area Human Services approached me, these 4 students had a $30,000 budget to work with that they were able to do some amazing things with here in our city. Again, and that's from me, this started from the relationship, me taking the meeting to go support Vivian 2.5 years ago. Okay. And so when I say that collaboration, I call that the collaboration that keeps on giving. And so this is Dawn Collins. She is with Capital Area Human Services. She is doing a Narcan administration training right here. And so this was in August of 2019. That campaign, the one I just showed you, Minor Misconceptions, was in spring of 2019. Our office in Capital Area vowed to keep working and supporting each other. And so I asked them, could they have someone come in and do a Narcan administration for the Southern University Police Department, who had requested training on that particular topic. They came in, they did the training, and they provided all the officers with Narcan kits. And again, being able to meet the need of Southern University and to reinforce the partnership with Capital Area Human Services. Again, building those relationships that when Southern University called me with the need for technical assistance, I can look at one of the community partners that I've established a strong relationship with me to come in to do the training for them, free of charge, all of that. And we provided them lunch. Right. So I don't want anyone to think that everything is a strike. Everything that I swing at is a strike. There are some misses. And so if first you don't succeed, keep trying. So this was from a presentation that I did back in 2015 at our annual summit that we host. We had gotten a grant in 2014 from Transforming Youth Recovery. We were in the process of starting the collegiate recovery program at LSU. We were already providing space for AA meetings on campus, which still are going on Wednesday, 7 p.m. in the Student Union. One, trying to provide space and resources for our students in recovery that identified as being in recovery. At the time, there was no office, and still to this day, there's no office for students in recovery at LSU. We had kind of designated ourselves to be that place when we found that out. And so what we did is we decided to start providing resources for students in recovery. We had some great meetings. We had some very engaged community stakeholders. We had some meetings, and then nothing happened, nothing. And so when our office moved to the Louisiana Board of Regents in July 2018, and so I won't say nothing happened. One of our students did transfer he got an amazing scholarship for physics at another university. And then the other one graduated, two other ones graduated. One of them, first ever letter of recommendation I wrote for graduate school. He's now a social worker, intending on helping other students in recovery make it through college. But nothing happened on the campus level. And it's been 5 years since that meeting, since that particular summit. And so when we moved, no one kind of picked up the ball with that. And so I still, to this day, as of a couple of months ago, I still get calls for parents of students who are in recovery or things of that sort. I refer them to two of my contacts on the campus who I know will put them in good hands and can tell them what the university offers, but we're still working on expanding collegiate recovery in our state. And I can talk about that at the very end. But I want to encourage you to keep on pushing, because this is a presentation that I did, an introduction to collegiate recovery, what campus administrators need to know about getting started, that I did in March of 2019. That 4 years later, I did a presentation for for one of our systems. So at the Louisiana Board of Regents, we oversee the 4 public systems of higher education in our state. We have the Southern University system, the LSU system, the University of Louisiana system, and we have the LCTCS. That is our technical and community college system. We have an additional association, LACU, which houses all of our private campuses, but we oversee the 4 public systems. And so one of our systems, the UO system, the University of Louisiana system, one of their board members went to a presentation and said she found out about collegiate recovery and asked, what is this and why don't we have any programs in our state? And so it's one of those funny things where you get sent an email and there's so many times it's been forwarded, but you realize way at the bottom that you could have gotten an email to start with, or that it started with you. So I got the email after tons of forwards, and it was like, do you know anything about collegiate recovery? Is there something that you know about collegiate recovery? I got it from an email from the UL system. It's like, absolutely. I was like, actually, you have a campus in your system that has been trying to start a collegiate recovery program. They just have not been able to get the support that they need to move forward. And that's one of the things I think that LSU is lacking, and that I've noticed as consistent among successful programs, is strong administrative support to make the programs happen. And so we did that meeting in March 2019. I presented to some of their board members, some of their campus administrators. And then that was, again, March 2019. And the reason why we keep trying is because the date on this particular article is April 1st, 2019, is that the headline was Teen Comes Clean with Struggle with Painkillers After Cancer. There was a young lady who had ovarian cancer who got hooked on pain medication after that particular surgery. And that's important that we keep trying to build campuses that are prevention ready for our campuses and recovery ready, because after attending BRCC, our local community college, she plans to transfer to Southeastern Louisiana University, where she wants to study medicine. So one, and that's me asking our campuses, are we building a type of places that meet the needs of our students that are coming? So that's explaining to them what collegiate recovery is, explaining to them the Association of recovery high schools, explaining to them young people in recovery that you will begin having first-time freshmen that are entering in recovery. And do you have the supports in place to be able to help make their matriculation successful without having to sacrifice their recovery in the process? And so, and the reason why that was really important because last year, Southeastern Louisiana University launched the first collegiate recovery program in our state. And so it was an amazing lift by our campus folks, and we were able to, again, lend our ear, just supporting our campuses, the technical assistance. So had I been still at LSU, had we not been in our position at the Board of Regents, I think that lift would have been a little bit heavier. But again, looking at social capital, looking at the positional power I have, being able to send an email from the Louisiana Board of Regents, being able to use that leverage to help assist our campuses. That goes a little bit further from me sending an email from the basement of LSU somewhere. And so being able to use your leverage for good. And so we officially celebrated the launch of Southeastern's Collegiate Recovery Program last fall, in September. This is a picture of our Commissioner of Higher Education, Dr. Kim Hunter-Reed, with one of their alumni from Southeastern who helped to start their program. Her name's Madison. And one of the most important things she said that day was that she gets a future now. That she felt like being able to attend this particular program gave her a future after 3 years of sobriety. And she said, you'll never know what it felt like to open that letter and to be able to read that I was accepted, that I could start over, that I had another chance. And so for us, that working with our partners at Southeastern, over in the picture with the three of us, on the far left, you'll see Madison, who's a new mom, Madison, who is the coordinator for the Collegiate Recovery Program at Southeastern, and Annette Baldwin, who's our liaison for our campus there. But we presented this particular presentation at the UO system, their system conference. There are 9 campuses in the University of Louisiana system. And as we talked through the presentation, we have 4 of the campuses who are interested in starting collegiate recovery programs. And throughout our state, we know that Tulane University is set to launch their collegiate recovery program this fall. I'm not sure how COVID-19 will impact that, but I think they're still online, ready to go to launch this fall. But our goal is to help spread collegiate recovery throughout our state. And so over the next 2-3 years, that definitely will be one of our biggest pushes, expanding collegiate recovery in the state of Louisiana. Okay. And again, so that's some of the campus things we've been able to do, some of the policy things we've been able to work on. But again, being able to leverage our statewide focus, leveraging our policy that we have, our policy influence that we have by sitting on the statewide task force. So sitting on the state epidemiology work group, the prevention systems committee, the HOPE Council that focuses on opioid prevention and education. How do we use that to leverage that? And how do I leverage the relationships that I've made on those councils to help impact things for our campuses for the greater good? So this was a conversation from that's me over there in the corner, at the White House for the Office of National Drug Control Policy back in November of last year, where we're talking about campus naloxone access. One of the things we know is that the rates for opioid use are lower, use and misuse are lower among college students than they are the general population. That's true nationally, and it's definitely true in Louisiana. For all of our campuses, we don't have a region where, out of our 9 regions that we don't have a region where opioid use is higher than cocaine use in our state. And so we know that opioids and stimulants are both a problem for our state. And so one of the things that we've been able to frame the conversation is that looking at doing good prevention on the front end. And so is that we know that we're behind the ball constantly with the A ball with alcohol. So what we're explaining to them is that we can't afford to let another substance creep up to the level of alcohol usage or even marijuana or cannabis uses at this point, that we cannot fight that many fronts at once. So what we do really good prevention on the front end to keep those particular numbers lower. And yes, that's me and my best friend, Surgeon General Jerome Adams, discussing the importance of putting naloxone everywhere, making it accessible everywhere that we possibly can. Again, so I mentioned that being at the Board of Regents has leveraged the positional power and the type of social capital that I have access to for our office. And that became very important. And so these are some of our state elected officials who were interested in passing some type of opioid related policy or law this particular legislative session. There are varying degrees, but they were all except one were called upon by two of them were called upon by a family who had lost their child, their student, to an opioid overdose. One of them was judging a mock competition at Tulane University, and students brought it up to him, raised the issue with him. And then also Senator Barrow, who serves on our Hope Council with us as well, she was interested when there was an incident last year where we had students who had opioid overdoses on a campus, and it was found out that all of our campus law enforcement does not carry any form of naloxone. And so that became an issue for her. Why don't they carry it when it's free from so many available statewide resources? And so we were able to work on some things to be able to create something that was able to garner the support of all the people you see listed here. A policy that we'll be rolling out this fall for all of our campuses, which I'm very excited about, and I'll talk about in just a second. And so one of the things I always tell the campus is not to chase the shiny carrot, because one of the things we know that nationally, and we always tell our campuses, make data-driven decisions. Be sure that you're making data-driven decisions. And we know nationally the money is on opioids. That's where the money currently is. But also we know that particularly for students, that they don't tend to recognize drug classifications. At least our students here in Louisiana don't. Typically, they may say that they don't take opioids, but they take Lortab or hydrocodone. They don't tend to recognize the drug classifications. But one of the things we've noticed is that our campuses are not only, they may see some opioid use, but they're also seeing an increase in stimulant use. That tends to be the issue on our campus. Ritalin, Adderall, Vyvanse, those types of drugs. And so what we want to do is being able to, again, use our social capital to kind of combine and see what we can do effectively together. Because even looking at the college prescription drug study, we see where the issue is just nationally. For college students, stimulants tend to be more of a choice of drug versus pain medications or sedatives. And so this is from the college prescription drug study from the Ohio State University, their College of Pharmacy. And so this tends to prove true in our state as well. That's when we look at drug classification, that stimulant use is higher, followed by sedatives, followed by pain medication. And so how do we take that and say, this is our issue, but this is where the funding is, and how do we meet in the middle? So, and that's where compromise comes in. And so for us, that's saying, let's take something that I understand that's where the money is. I get that. And so one of the questions early, the statements I talked with our Louisiana Department of Health that funds us, and our state has the state opioid response grant, which a lot of states do. And a lot of them don't use them heavily in their college population, but ours does. But one of the compromises I made with them is that I can talk about opioids, but you have to allow me to also talk about stimulants at the same time. We're not taking away from the impact of talking about opioids. We're just adding additional substance to address. And they were fine with that. And so for us, that led us to Generation RX, which focuses on medication safety practices. And so the 4 key messages are using a prescription as directed by a healthcare professional, not sharing or taking someone else's medication, keeping your medication safe, and modeling safe medication practices. And what was really appeasing for us for Generation RX is that there was already free material that they had already compiled, excellent video resources for opioid use and stimulant use. And so this gives us something we're able to have turnkey, the toolkit, the university toolkit, to be able to utilize, not having to reinvent the wheel, utilizing partnerships, and one that our state had already begun to train their regional prevention offices on Generation RX and recommended that they use it. So my goal was, we're already using it in our elementary and teen populations, in our older adult, in our medical community. Let us use Generation RX, the university toolkit, for our campuses, and we'll talk about opioids. In addition, we'll talk about stimulants as well. And so it's been going very well. And so earlier in the presentation, I mentioned that we do regional trainings. So for us, earlier this spring, we had gone to Baton Rouge, Lake Charles, Shreveport, Monroe, and Lafayette before the interruption of COVID-19. And so at each of our regional trainings, the people that you see, except for the top middle, Those are our campus community partners. We work with the local regional behavioral health office, our community office there. They find us a free space to utilize for the training. And then we also ask them to provide a local person to do a Narcan administration demonstration for all of our campus partners. So in the morning, I went over our core survey results in 2019. I talked about we talked about some regional specific things that are happening. And in the afternoon, I go over Generation RX, the university toolkit with them that they're learning that will be implemented on our campuses this fall. And then at the end of the day, our community partner comes in and does a live Narcan administration training, which was wildly successful at all of our regional trainings before we had to stop due to COVID-19. But all of our campuses were very pleased with the training. We'll be looking to implement that this fall. And so we're training trainers for our campuses. And we were talking about having larger trainings, which will look a little different now due to COVID-19, but having larger trainings where we train multiple people from a campus, 20 or 30 people from a campus, where they can train additional student groups and peer leaders on their campus to train students about the warning signs of opioid overdose, how to administer naloxone, things of that sort. And so one of the things that has led us to is that I mentioned the national recommendation that placing naloxone on campus is a great idea. To our state legislative interest, that we had legislators in our state that were interested in moving on naloxone, some type of naloxone policy, that deferred to us after seeing what we came up with. We knew that there was an appetite for a policy there. So pending final approval at our board meeting, either later this month or our August board meeting, we will be approving our opioid education training and reporting policy, which teaches students the dangers of opioid use and how to spot an overdose, places free naloxone on each campus, and establishes a reporting protocol for naloxone administrations. So when I say places free naloxone on each campus, we have secured funding for the first round and at least the second round, the first and second round. The shelf life is 18 months. We've secured funding for the first and second round of naloxone kits for all of our campuses. We did assessment. Every campus can request whatever amounts that they need, that we'll place them on certain places around their campuses, and that that certain people have to be trained. So the campuses will have to provide opioid education training, education for the entire campus community. So that's either they can show the Generation RX videos, they can do social norms campaigns, they can do all types of educational awareness campaigns. Then the second part of the policy is that certain demographics will have to be trained. So every student who lives in a residential facility, Greek or campus owned, will have to be trained on naloxone administration. Every student that lives in the collegiate recovery residence will have to be trained on naloxone administration. In certain categories of employment, so all campus law enforcement, all residential housing staff that lives in residential housing, all of our health, wellness, counseling center staff, our athletics center staff will all have to be trained on naloxone administration. And then lastly, the reporting protocol it establishes. So anytime there's an administration of naloxone on campus, the campuses will have to report it to their systems, and then will make a report to the Louisiana Board of Regents. And so that way, we're able to provide free training resources via Generation RX. And so at our regional trainings, I created a Generation RX training manual based on what I think would work well for our campuses, and we provide them with free manuals that they can use for training. They've all gotten 20, 30 copies. We have copies for all of our campuses, but being able to provide them with the free training resources, and then also provide them with the free naloxone and a little storage bag kit for them so they can have it secured on their campus. We're trying to provide the training and alleviate the cost associated, as much cost associated with the policy as well. But again, that comes through partnerships with Louisiana Department of Health, leveraging the partnerships that we have. And I say, we're funded by you all. Yes, we would like to implement the opioid policy, but I would like some money to buy the naloxone for our campuses, because that would be a great thing that, it's a public health crisis, but we're also looking at this is part of our general public. Let's support them in that way. And so we were able to secure some funding there, that our Department of Health is on board, that our Board of Regents is on board, that we're just waiting final approval of the policy at the time of this recording. So inclusion, I want you to remember 3 things. Evaluate everything and everyone frequently. find out what are you participating in that no longer serves your interests or the initial intent that you set out to. Missions, visions, goals change sometimes. Be okay with realigning. Um, Leverage your networks. Don't be afraid to call on people who you think can have an impact, a great impact on what the work that you're doing that can help enrich the work that you're doing. And don't be afraid to when someone calls upon you. And then to prioritize and reprioritize as often as necessary, particularly as we're in the midst of a global pandemic. A lot of organizations are restructuring, retooling what they have going for the rest of the year. So there may be something that was a priority for you on January 1 that's no longer a priority for you, that you may need to reprioritize and restructure. Even some of the connections and collaborations that you have, you may have to put off a collaboration for right now to focus on something that would be more fruitful, more important right now. And so the last thing I'll leave you with to help you do that is something that I use myself. It is a monthly triage sheet, and I can make this available wherever they'll post a recording, or I can make wherever there's some resources available. This is how I kind of separate what I need to do for the month or who needs me for the month mostly. I place the people in the red column that's ongoing, those who need constant technical assistance. And that changes each month. So I may have somebody that we're working on. So for instance, when we were working with Southeastern for their official launch of their collegiate recovery program, for about 6 to 8 weeks, they stayed in the red category. That was something I had to constantly check on, constantly check in with. Do you need anything? What else can I do? How can I assist you? Then we have those that are in yellow. They're on standby. They may need technical assistance requests for a very limited or very specific request. Like this month, by the 15th, this person needs XYZ from me. So it's not something I have to check in like every day or even every week, but there's something that month that person needs from me. And then my green people, that's my autopilot folks, those who may need a guided answer or a connection made. That may be somebody, a community partner that says, hey, I'm working on a community wellness event in Lafayette. Can you give me a contact at the University of Louisiana at Lafayette to help me, that may want to set up a booth there? That's a very quick, short answer response. Those, I kind of get those out pretty quickly. And then blue, that's my back burner. Those who have a random out of the blue are like left field requests. Those are people that you typically don't have a ton of relationship with, but focusing on too many of those requests will stop you from being able to do the red, yellow, and the green, the one that you have vested relationships in. So being able to prioritize who needs what from you first and what can you get done first. And so that will conclude our presentations. If you have any questions, please feel free to. The quickest way probably to get a question to me is probably actually on Twitter. If you mention me on Twitter or send me an email, I will get back to you as soon as possible. Thank you for having me, and I hope you enjoyed today's presentation.
Thank you so much. I really appreciate you taking the time to do this. I just want to remind everybody that this information, the presentation, it will be available on YouTube under a password protection for conference registrants, and we will provide that to you. Thanks again, and I wish you goodbye.
Thank you.